Welcome to this Open Dental webinar. Today, we will be talking about clinical notes in Open Dental. In this webinar, you will learn how to enter a procedure note, how to set up and use default notes, quick paste notes, auto notes, and group notes, electronic signatures in relation to clinical documentation, and we will discuss permissions to allow and block users from editing clinical notes. Procedure notes are daily treatment notes that are stored within the procedure. To create a procedural note, double-click into the procedure. In the Procedure Edit Info window, over on the right side is your Notes field box. Notes can include anything that normally goes into your chart notes, such as materials used, procedures followed, treatment performed, anesthetic administered, informed consent, etc. Procedure notes also support electronic signatures. You can enter a note by simply clicking into the note window and typing your note, but manual typing notes will be a time-consuming chore, so we have other methods to help streamline your note writing process. You may find that one method works well for you, or you may find that you use a combination of the methods I'm about to go over with you for making your clinical notes. Default notes are notes that will automatically populate when either treatment planning a procedure or setting a procedure complete. Then staff can just make some minor changes to the note as needed. To add default notes into your system, go to Lists and then Procedure Codes at the top of Open Dental. Select the procedure you wish to add a default note to and double-click to open the Edit Info window. You'll note that there are tabs along the bottom of this window for completed notes, treatment plan notes, and default claim notes. The completed note will be a default procedure note that automatically copies to the Procedure Info window in that Notes field we were just in when the procedure is set complete. A treatment plan note is the default procedure note that automatically copies to the Procedure Info window in the Notes field when the procedure has a status of treatment planned. Keep in mind, this does not work for procedures charted using the Make Recall button. The default claim note is a note that automatically copies to the Claim Notes field when a claim or pre-authorization is created that includes this procedure. You'll notice in the Claim Notes field in the lower right-hand corner that it would populate the narrative that you've entered for this procedure into that Claim Note field. You can also add in notes and specific times that a procedure would take by a specific provider. Choosing the time pattern that the specific procedure will take for the provider chosen over on the right, if that provider needs more or less time for his particular procedures when they are done. The slashes and X's are going to go based off of the time pattern you have set up in your appointment book. That could indicate a 5, 10, or 15-minute increment slot. The slashes should be considered intake and outtake of the patient, and the X's for actual provider time. If your provider has a note that they'd prefer filled out a certain way, you can create that note into the note field. Some providers prefer to use 2 quotation marks to indicate where information should be entered and what should be asked. If the information is not completed, the 2 quotation marks will create an incomplete note warning that will appear above the note. Other examples can include composite shade, crown shades, denture shades, due dates, blood pressure, nitrous levels, etc. I'm going to click OK here, and you'll notice that my notes and times for specific providers has been populated. Once this procedure is set complete, specifically from Dr. Beasley, it will indicate that note on the procedure automatically. To use auto notes in Open Dental, our auto notes are templates that are used frequently for larger notes. They can contain pre-filled text or prompts that can prompt you to enter information. You can add an auto note in the Procedure Edit window by double-clicking to open up the procedure, and just above the Notes field we were in earlier is the Auto Note button. Clicking on the Auto Notes will open up any auto notes that have currently been created on the left-hand side to choose from. Choosing from the auto notes and then clicking Insert will start the prompts to make sure that you do not miss asking or checking specific information for this patient's visit. If you get to a prompt where you aren't going to ask that patient, you can remove that prompt entirely. You can choose one or multiple in some prompts, or have prompts that will allow you to type in text, such as this one. If you don't have that information yet, you can click the Skipped for Now prompt, and it will skip over to the next prompt. Go ahead and fill out all of your notes to make sure you haven't missed anything in your prompts fields. Clicking OK will add your note to the Notes field. You will notice that since I skipped a few of my prompts, I now have an Edit Auto Note feature above my Notes box. This is helpful to quickly get back to the prompts we haven't finished yet. Another feature that you can use the 2 quotation marks for is also within the Notes field. Putting 2 quotation marks either into your auto note or at the end of your auto note will mark that note as incomplete. You can put signatures in your note with the signature box with either a mouse, stylus, or topaz signature pad. Click OK, and once that procedure is marked as complete, you can track any incomplete procedure notes or unsigned notes in your standard reports, in the daily section in incomplete procedure notes. To include procedures that maybe you forgot to do a note for any of the procedures that day, and also to include procedures where the note was unsigned. If you're using clinics in Open Dental, you may need to change the clinics to the specific clinic for that patient, and then refresh your list. If you have not set the procedure complete yet, and that procedure is still treatment planned for the patient, the incomplete procedure notes report will not show anything. The procedure does need to be set complete with a status of complete for those incomplete procedure notes to show in this list. You'll notice it marked my note as incomplete. There is a field for no note if you have some patients who don't have a note on any procedure that day, and if the note is unsigned. If you're in a separate patient and just trying to get back to your patients quickly to finish the notes for that day, a simple right click and See Chart will take you straight to that patient's chart for you to double click and open up the procedures, edit your auto notes if needed, and then remove those 2 quotation marks so that it's no longer marked as an incomplete note. At this time, we're going to go ahead and sign and click OK. You'll note that my note is now listed on the procedure I set it complete for, and my note is also marked as signed. To create auto notes in Open Dental, you can start by going to Setup at the top and down to Auto Notes. To create an additional note inside of your Auto Notes feature, select the category if you've created categories, and click on the Add button. If your practice has another clinic that uses auto notes in Open Dental, or if somebody is willing to share their auto notes with your clinic, you can export auto notes from one Open Dental user and import them into your system. Clicking on the Add button will allow you to generate a brand new auto note. We're going to start by creating an auto note for Crown Prep. You can either configure the text of your note first or your prompt first with the Add button over in the top right corner. Either way, it is helpful to know how you want your note formatted before you start. Let's create our prompts first, then create our note, and attach those prompts to the note. We'll start by clicking the Add button and create our prompt for shade. I want to be able to type out the shade each time, at least for now while I'm getting used to how this note works. So I'm going to leave my type as text. And you can leave your text as blank or type in a few options of shade that you might want to be able to choose from. Clicking OK will now add that as an available prompt under shade. I'm going to put the word shade over here so that I have a way to reference what this prompt is asking. And then I'm going to insert that prompt right next to my field. Next, we're going to add in a prompt for the initials for that particular doctor. And I'm going to choose this time to have different responses I can choose from. I'm going to choose my one response so that whoever is filling out this auto note has to choose which provider's initials of who did the work. Clicking OK will create that prompt as well. And my very last prompt to have a multiple response for the tooth number. Clicking on the Add button, we're going to put in our tooth number and multiple response. You do need to create one line per item to be able to choose from multiple responses. For things such as teeth, you will want to indicate any teeth that you would be selecting. And clicking OK. Now to show you how to use this new auto note that we've created, I'm going to set complete a crown procedure. Choose my tooth and choose my auto note. Clicking OK, I've now finished my auto note in a few short clicks, and I can sign my note. I can now right-click on my procedure and set it as an existing current provider did the work. I can even double-click and change my date to show that this was actually something I've done in the past. Let's go over quick paste notes, which are an additional way that you can add in very short or long sentences quickly. We will double click back into our note and an option for a quick paste note is available in any of the note fields inside of OpenDental. Right-click in the note area, and you can choose the Insert Quick Note. You will see a list of categories on the left-hand side of this window. You can create additional categories to group similar types of quick paste notes together with the Add buttons to add in a new category. Quick paste notes can be used for the front desk as well as for the back office. Choosing your type to be able to group it together and clicking OK after giving it a description will add in a new category. Because I'm in a procedure note, it automatically took me to the procedure category. And we can see over here on the right-hand side that I have available quick paste notes to choose from. Creating new quick paste notes in the system can be done with the Add button at the bottom, or editing quick paste notes with the Edit button if I want to change the verbiage. I can also change where those quick paste notes are showing by using my up and down arrows to change them around. Clicking on the Add button, I can put in a very short abbreviation, such as PComp, to type out the word posterior composite. Clicking OK, I now have that option and a question mark has been put next to my abbreviation. Because of this, we will go ahead and click OK, and that will fill in our quick paste note. That question mark allows you to type in a question mark and a short abbreviation right afterwards to type out a longer note than just being able to freehand type it. Group notes are another way to create a single clinical note for multiple procedures. In order to use a group note, the procedures must be set complete on the same day by the same provider. To create a group note, highlight all procedures done by that provider, right-click, and select Group Note. You can even add more than one auto note if you are doing more than one type of procedure. You'll have the option to edit your auto note from here, add in a new auto note, or the option you just saw of right-click and insert a quick note. Now that we have a group note, you'll notice at the bottom that my procedures that this note is linked to are showing, and my note has aggregated both of my procedures notes into one. I can now sign the note here and click OK. Aggregate group notes allow you to create a group note that pulls in procedure notes starting on individual procedures. The preference is enabled from the Chart module preferences under Setup, Chart, and Chart Preferences to be able to procedure group notes aggregate. While we're in this section as well, you can allow digitally signed signatures if you'd like to. If this feature is turned on, when you're inside any of your notes, you will also have the option to click on an E to digitally sign by the user who's logged in. Once again, going over some of the options for electronic signatures, you can sign procedure notes using the Topaz Signature button, which is shown here. You can also use a stylus on a tablet PC or similar touchscreen. When signing with a stylus, information about the speed of each stroke is recorded, so can be used to identify the signer. Signatures created using a mouse or by marking a checkbox are still valid electronic signatures, but with just a mouse signature or click, it's not possible to verify the person signing. Each signature is electronically linked to data it applies to, and if the data changes, the signature is invalidated or cleared. Just putting a simple space will clear that signature where it will need to be signed again. To go over quickly with electronic signatures, That information can be found on our web manual page at opendental.com and searching electronic signatures. A couple of recommended styluses for Topaz signature pads can be found here. Procedure Note Management also allows all completed procedure notes to automatically and permanently be stored in your database. Every change, editing, or deleting a note is recorded. An archived note history can be viewed in the Chart module under the Show tab. We'll click on the Audit box here, and all those notes that I've currently made to each of these procedure notes is going to show up in a custom view. You'll note that inside of this particular note, it shows who made those edits and when, as well as what the note looked like at each of the stages. When my note was aggregated and then signed, that also shows on there. The archived history of completed procedure notes is not editable and cannot be deleted. It may be important to note that it also cannot be restored. In the event of an accidental deleted procedure with a clinical note attached, you can look it up in the audit mode, but it would need to be re-entered manually. There are some permissions in OpenDental that can affect users' access to procedural notes. Permission-based locking. There are several user permissions that affect access to procedure notes. You'll want to set up permissions by group under Setup and down to Security. Your security settings are going to look similar to this. Will allow you to add in users and different user groups. Under this same section, you'll note, and we'll have this down in the links for you, the Security and Users Permissions webinar. We can also see the Permissions section of OpenDental, which includes the note features and the security permissions attached to certain procedures. The Edit Completed Procedures full allows you to edit, including deleted procedures. The Procedure Notes full, up here at the top, allows you to make changes to any procedure note. The Procedure Note Same User and Group Note Edit both will allow the users to make changes to procedure notes that are unsigned or they have signed themselves only. These permissions will block the users from changing procedure notes signed by someone else. The Edit Note on a completed procedure. Without this permission, the user would be unable to make any edits to a note on a completed procedure. This permission can also be set to only allow edits for a set number of days or a newer than a specific date. The very last option in our procedural notes, which has the strictest protocol and is seldom used, is Procedure Note Locking. Procedure Note Locking has to be turned on under Setup, Chart, and Chart Preferences. Procedure locking is allowed. This option is not normally used, and this note will pop up indicating that you're turning on something that can be turned off later. However, any procedures that are marked as locked will not be able to be edited afterwards. To show you what a locked note looks like, we're going to go back into that procedure. You'll notice a lock symbol in the top right-hand corner of our group note. You can also see on the procedure itself that if we double-click, you'll notice a lock button in the top right corner here as well. Keep in mind that when you lock a procedure, regardless of the security permissions you have, in case of a mistake, you can mark locked procedures as invalid or append them. But locked procedures will remain locked. Going into those locked procedures, you'll have an invalidate box to completely invalidate this procedure, or append if you need to make changes with an appended note, but you will not be able to edit the previous note. We now have our note, and you'll notice the appended note at the bottom. The invalidate button is going to invalidate that group note, but it does keep a record of it in the chart that they had a note and it's invalid. To remove the note completely would require deleting that procedure and recharting it over again. This concludes our Clinical Charting 2 Clinical Notes webinar. Remember, you can choose to use one of the strategies outlined in this webinar, or you may choose to use a combination of them to help you be more efficient and effective at charting your clinical notes. If you have any questions or need help, please feel free to call our support line at 503-363-5432. Thank you.